So family intervention models for addiction recovery. Listen, there's a lot of different models out there. A lot of people trying to reinvent the wheel. A lot of people with all of these different theories. The biggest ones to consider is the originator of intervention, the Vern Johnson model, which was a hardcore in-your-face model. Today, regardless, they're all based on a family systemic, or they should be anyway. The definition of an intervention is a clinical action taken to address a problem or behavior and to meet a set goal of improving the problem or behavior. And how you get there is by addressing the family first. That's where the name comes from. So many interventionists and their models are about talking the person into treatment. Several times we've talked to families and they've gone with another interventionist who is a solo interventionist with maybe or maybe not a website or an office, who comes in for almost the same price, does very little family work, and talks their loved one into treatment. Those same families always call us back within 6 months to 2 years that their loved one is back at it again and they don't know what to do. Intervention models should always require putting a family at the forefront of the change, and then everything else comes with it. So whether it's a systemic model, whether it's the Vern Johnson model, whether it's the invitational model, at the end of the day, it all comes back to a family holding boundaries, holding their loved one accountable, getting past and through and past your dysfunctional family role that you've acquired, and the behaviors of thinking you're in control of the situation. If the family doesn't get help, the substance user or the person with mental disorder rarely does. You have to remember, the model must focus on the family being the belief of the pain. In other words, the person who needs help is always going to believe that the family is the reason for their current situation. And if we don't take that away, if there's not some type of ownership put back on the patient, they're not going to address the problem. So the model that needs to happen is the family first must change, period. And if we don't do that, and we just bring in these high expensive interventionists who give speeches and whisk your loved one off the treatment and move on to the next job and provide no ongoing support, you're going to be back in the same position you were in before it all started. So the model that you want to focus on is inner reflection of family system theory so that the family can get better even if their loved one decides not to.